going to discuss about the exact what the pharmacists do in hospital practice. So no doubt, pharmacists play an important role in supply of medicines, supplies, vaccines, and therapeutics. When you are coming to the medicines, already I said that when you are coming to the supplies like face masks, N95 masks, face shields, PPE kits, sanitizers. So you should be ready, and you should be ready as per the demand. You have to keep it in the inventory. Then vaccines, you have to procure the vaccines, and it should be distributed rationally for the public, and make sure that pharmacy services are extended round the clock 24/7, and pharmacists also involved in close contact services. There is a debate whether the pharmacists are eligible to give injections or not. Injection in the sense either it is a vaccine or intramuscular. So no doubt pharmacists are eligible. See, any person are eligible if they are going to give injections in presence of a physician. So even nurse cannot be eligible to give injections. But this is a close contact services where even pharmacists with a skill of giving injections, they can start doing this practice. And also COVID testing, it is a matter of just 3 minutes. COVID test can also be done in a pharmacy, especially in the community services. Without depend on any other, you can do this test, rapid test for antigen, rapid test for antibodies, and together test will also be there. Then hospital isolation and sanitization, especially when COVID patients are entering into the hospital, knowingly or unknowingly. If you do find that they are COVID infected patient, the hospital should be isolated. So all the hospitals should be sanitized with the hypochlorite solution, and make sure that it is free from virus. Then you have to admit the patients for further treatment. So all these activities as per the protocols of the central and state ministries. Then attending the patient request. There are so many queries for the patient because of the easy access. So patient will have drug-related queries or disease-related queries or even testing, COVID-19 test queries. You must be ready to answer all these questions. Then even the mechanism of drug distribution that can be simplified by addressing or by adopting refilling, labeling, and brown cover packages for the patients. And pharmacists will also be involved in disease management system, especially they are eligible for treating the patient for patients at home care, at the doorstep of the patient. So all chronic diseases can also, because most of the hospitals are closed during the COVID-19. So there is a good chance for the pharmacists, especially if they are trained clinically, they can take care of the patient at the doorstep of the patient. The pharmacist can also be involved in clinical development of the clinical protocols and hospital administration. Because of the clinical pharmacists, they can design clinical protocols so that the research, education, and practice and leadership to lead the team can also be there with the pharmacists. Here the picture is inventory management. These are the two people who are working with me in my inventory management. Next slide. So pharmacists also be involved in development of the clinical guidelines by reviewing the literature. This is also one of the important activity of a clinical pharmacist. You have to review the literature and you have to design the protocol. I will give you one example how the protocol really help in hospital practice. Then even you have to set the quantities required in the for the various units that are available in the hospital. Then one more important activity is reporting of medication related errors. This is also one of the, pharmacists should be there as a part of the review committee in every hospital, so that they will take care of any drug related issues or errors, so that it can be rectified in near future. And finally, even the services, there could be a rapid access for the emergency medications. So there should be a flexibility in drug distribution system. You have to be very flexible. You have to come out of your protocols of your hospital due to COVID-19. So all medications should be easily available for all the people in hospital so that it will run smoothly. So these are one of the picture shows that this is one of the example pre-packing. So all the drugs are kept in a brown cover with a label. It will be handed over to the COVID patient so that there will be a minimum contact with the patients. Next one.